Welcome, Dr. Sam fans, to the latest edition of AFD TV. I am Jason Lane, General Manager of the National Office of Claris Networks, and my claim to fame is being the biggest geek in all of Claris and possibly Tennessee. To the left of me, weighing in at treating over 200,000 Nashvillians in the past decade is Dr. Steve Samudrala, also known as Dr. Sam and Geek Wannabe. Next to Dr. Sam is our special guest, neurosurgeon Dr. Sanat Dixit of Pinnacle Surgical Partners. And today, on today's episode of AFD TV, I have no idea what we're going to discuss, but knowing Dr. Sam, it's going to be both informative and entertaining. Take it away, Dr. Sam.
Well, thank you, Jason, for that wonderful introduction. I sound pretty strong here. So, well, this is Dr. Dixit. He's a partner at Pinnacle Surgical Partners with both neurosurgery and orthopedics.
Correct.
And you being here with Jason, we're going to talk about technology.
Awesome.
And technology, we're clearly in a new age. And so tell us a little bit about some of the technologies you use for neurosurgery.
Absolutely. Well, neurosurgery is a high-tech profession. It's got that cachet. What's really been exciting about the evolution of neurosurgery for me is that we're able to take care of the same disease processes that we started taking care of 40, 50, 60 years ago, and do it through smaller incisions, through much more advanced technology. You can say that technology has helped to redefine what it is that I do with brain surgery and with spine surgery. So it's really actually very exciting.
So technology, having your computers work and your technology work 24/7, 365 is more important than ever.
Absolutely, absolutely. But again, the technology is just a tool. It doesn't make things better by itself. They have to be utilized the proper way. And that's the nice thing about having these great tools now, is that we're still able to deliver great care and do it a little bit better with some of these really high-tech tools.
What's your favorite tools?
Well, my favorite, I treat brain aneurysms. I love treating brain aneurysms. They're a very difficult thing to treat. The traditional way to treat brain aneurysms has been to do open brain surgery. And I'm able to treat 80% of the aneurysms now that I take care of through a small incision, minimally invasively from inside the artery. It's really revolutionized one aspect of my practice, and that's probably been one of the most revolutionary things in neurosurgery over the past 15 years.
And with more technology, is there less surgery that you have to do with a scalpel? You can do more without a scalpel?
You can. There are quite a number of things that we can take care of with image-guided surgery and even radiosurgery, where you can take care of problems deep within the brain by using a very focused beam of radiation. Again, these are tools they didn't have even 50, 60 years ago. It's changed how we practice.
Definitely. And as far as a lot of technology, you think about the state-of-the-art medical centers, Mayo Clinic, CAT scan, MR, PET technology. Now, the other technology where Jason and I actually have more experience in is outpatient medicine. What technology have you utilized in your outpatient practice that has been helping you?
Very simply, the biggest one has been doing minimally invasive spine surgery. Typically, spine surgery has been done through very long incisions where you strip a lot of muscles with a lot of pain, lose a lot of blood. I'm able to do a lot more of the operations through maybe 1/4 inch or 1 inch incisions now, quicker recovery times. And makes it an outpatient.
Awesome. And then what about in your office?
In the office itself, we use electronic medical records. We're finding ways to engage the patients through the non-traditional means, not just email, but maybe even some other platforms where you can use telemedicine or other novel things to keep people connected with us. I know you're a big fan of doing that. I know
Definitely.
You've been on the forefront with that.
Yes, definitely. And thanks to Jason here, we've got the technology really in the palm of our hands. I mean, I can in a HIPAA secure way pull up x-rays, pull up my EMR, and care for patients anywhere, which I've been very, very thankful for and appreciative of. So,
the best part of the best part of this discussion is, though, we're still using the technology as a way to communicate and connect with the patients, but you're still connecting with the patients, and that's our first job.
Yeah, we have more ways than just having the patient come into the doctor's office during banker's hours to connect with the doctor.
I think it's appreciated.
Yeah, definitely.
Dr. Dixit, I've been amazed at where imaging technology has gone, the clarity and definition that you bring to the human anatomy. Is there any insight you can give us to what's headed around the corner in that area and how it's able to allow you to treat your patients better?
Well, the imaging is getting better, and imaging has probably been the most revolutionary thing for most medicine and most surgical specialties. But I caution people into putting too much weight on the imaging itself. The imaging is a picture. it doesn't give you the full bit of information. The best information that Dr. Sam and I get comes from sitting down and talking to patients and using the imaging as sort of to reinforce what it is that we think. The quality of the imaging is important. Getting good quality studies is integral, but it's still going to come down to looking at the patient, talking to the patient, touching the patient, and figuring out what's actually going on.
Definitely. And what the term we like to use is we not only want to be high tech, but most importantly, still be high touch. And we always treat the patient and not just the imaging in the labs. So and then, of course, even if the imaging in the labs point in a certain way, everyone has their own interests or needs and what they want to do. So and achieve in life. So yeah.
Well, Dr. Dixit, Dr. Sam, I really appreciate y'all's enthusiasm for taking care of Nashville and making it a better place. Thank you. This has been a great episode of AFD TV.
Oh, hey, and stay tuned to AFD TV. We're gonna be making a lot of progress here. Dr. Dixit is gonna be the new Sanjay Gupta, except even better. And Jason is working out. He's gonna put The Rock out of business too. Thanks for watching AFD TV.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Yadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.